I always have guys that start replacing their testosterone and they come to me and they say, well, I'm not feeling how I expected to feel. And so I ask them, like, how were you expecting to feel? You're not supposed to feel like Superman. Just because your testosterone's higher doesn't mean you're going to be able to lift a car or push a refrigerator. First of all, it takes a while for the testosterone to start causing its effect. It's important to remember that testosterone is not a drug, it is a hormone. And when we're talking about hormones, we're talking about a hormone that's floating in the bloodstream, has to go into a cell. Once it gets into that cell, it actually has to go inside the nucleus and turn on DNA. Once it turns on DNA, then you have to make mRNA. Then those mRNA have to make proteins, and then those proteins have to get to work doing stuff. And so it's not a quick and simple solution of testosterone to turn into amazingness. Just because the level in the bloodstream is higher doesn't mean you should feel perfectly well balanced just because it's higher. We see that definitely in women when we're doing bioidentical hormone replacement. We can get females' hormones optimized within a few weeks, but their hot flashes may not disappear completely until 6 months. Why would you say that? Your hormones have been balanced for 5 months now. Why are your hot flashes not gone? And that just proves the point that these hormones have to go everywhere, and they have to turn on DNA and mRNA and proteins and all that. So if you start testosterone replacement, be patient and wait and see what benefits occur over time. You didn't get low testosterone in a day or two. You got there over months to years. So be patient. Wait a few weeks before you notice the benefits. The other thing that many people forget is that if you're not feeling benefits of testosterone treatment, then it's very possible that you're missing things. The number one thing that I see missed whenever I'm replacing testosterone is adrenal dysfunction. So not everyone's ready to swallow that pill and decide that adrenal dysfunction is real and that it's really affecting them, especially men. They're very resistant to it. I was resistant to it. And so adrenal dysfunction, I don't want to waste much time on it, but adrenal dysfunction says that your cortisol levels are too high, your stress glands are producing too much hormone, and that's causing the system to be kind of wired and tired, so to speak. And you can have the most amazing testosterone in the world, but if any of your other hormones are off balance, you're not going to feel much better. So if you're insulin resistant, if you're diabetic, if your thyroid's off, if your adrenal glands are off, all the hormones need to be in sync and in balance in order for you to feel the best. So if you start replacing testosterone and your levels are great and you're not noticing any different, then it's time to keep looking. You need to evaluate further. If your doctor's not checking insulin levels and adrenal dysfunction, then you really need to ask them to look further or seek out a functional medicine doctor. So just to reiterate, you're not going to feel like Superman on testosterone replacement, but you should feel your normal youthful self. So if you think about how you felt in your 20s and 30s as far as energy, sleep, and good rested sleep, muscle mass recovery and all that, that's kind of what you're aiming for. You're not expecting to be the next bodybuilder or the next Arnold Schwarzenegger in his glory days just because you started testosterone therapy. You can get there with hard work. Just ask Arnold.